So Eva is my medical director in Shiba Longevity Center, and if we try to conclude what Eva said about all the biomarkers and all the importance of having bench to clinic, so we actually established the first healthy longevity department in an academic hospital, and we have 3 arms for our center. We mainly focus in on a longevity clinic, but we have also an important arm of longevity research and longevity innovation. So we actually, the main focus for us is our 4A. We wanted it to be accessible, the longevity, so it is in a public hospital. It's affordable, which means everybody can do longevity, not only in private clinic and not only in laboratories, but it's completely free for the first part that we are doing it. It's, of course, academic, so every test that we are doing, every intervention are all valid and evidence-based medicine. And as Eva mentioned before, AI is extremely important in longevity, and of course, it is incorporated in our clinic. So I'm the head of the Shiba Longevity Center. We have Dr. Avigail Goshen, she's the head of research, and of course Eva, she's our medical director. And we have our medical board, which is, as you probably know, of course, all the people here from Stanford, Tom Randu and Brian Kennedy and Professor Nir Barzilai, James Kirkland from Mayo, and of course Alex, which is in AI, and Professor Grossman, who is was the dean of medical faculty the last 8 years, and he was with us from actually from day one. So what are we focusing on in our clinic? So we started, as I mentioned, in a study that we are having 1,500 patients, or participants, they are not patients, with a SHARP study. This is the Shiba Healthspan Research Population Trial. Patients are coming, the inclusion criteria is whether you are above 50 years old with no neurodegenerative disease or cancer treatment in the last 2 years. Then you can enter the study. You have several questionnaires before you come, and then you come for a full day of assessment, which I'll elaborate in a minute. It's a 7-hour assessment. After this day, at the end of each week, we are doing randomization. The computer is doing randomization, having a study group and a control group. 80% will go to the study group, 20% control group. The study group, the 80%, will come back after 2-3 weeks for a summary. They get all the results and intervention, what to do, how to improve, and an application. The 20%, the control group, do not get the result. Then both groups come back after 6 months for blood check and some questionnaire and body composition test. And after 1 year, both groups come for a full day again of assessment. And then, the control group, we're doing crossover, the control group will then get the intervention. So they will get it a year after and another year after. So they kind of like having 3 times instead of 2 times. So we want to incentivize the people to come back because they are controlled. So what we want to see is whether there is a difference and there is improvement in the study group compared to the control group in all our measurement, biological age, and now we'll show you what we are testing. So we are starting this day. It's a full day, as I mentioned, 7 hours day. So we start with blood check, and we mainly also focus on a lot of biological age. So we are doing a metallurgical age, epigenetic methylation clock, and we try to and telomeres, and we are trying to develop other biological clocks such as cardiac, microbiome, photo age, NLP, physio, and clinical. And now I'll show you just a short movie. This is actually in our clinic, already having a patient from March. So you enter our clinic and you see it's a beautiful new area. You feel like you are very healthy there. You start with the 10 station. So first blood check is a full panel with hormone, biobank, different vitamins. It's metabolomics and proteomic. Cognitive station, so we are doing MOCA, Neurotrax, and Delphi, which is a new EEG stimulation and can predict Parkinson and Alzheimer. we're doing a lot of sensory, so vision, hearing, we record voice, we're having smell check, and oral hygiene. Then we have cardiovascular, so we do respiratory tests, we're doing fast echo, and ABI and PVW. And DEXA, body composition, together with a physiotherapy that is doing a lot of tests, equilibrium, balance. All the patients are giving microbiome. Women are going into gynecology for menopause, and men are questionnaires for andropause, and all of the patients are going home with a sleep assessment and sleep questionnaire. So, okay. So after this day, as I mentioned, the study group come back and then they get the results. We develop a specific patient dashboard, which is connected to the Chameleon, to the EMR, and in order that the patient will understand, because we are doing like 450 different results, it's a lot. So we kind of did it into a domains similar to what the patient is going through. So stamina, cardiovascular, sleep, and then it gets an algorithm that gives it a score between 1 to 100. So for example, this patient got the biological is 56, his stamina is 37, and it went down because of grip strength or 6-minute walk or low muscle mass. Then this patient get intervention. So it's very personalized, of course, according to the what we saw in his course. And we develop a special app. This app tracks your steps, tracks your stamina, your sleep, gives you questions. We monitor it, and we also see how the patient is doing. We call them, we see how many hours the patient slept, or did his intervention, or take his vitamins, etc. And we keep on tracking the participant every week, talk to them, and try to understand because the most important is motivation. If we want people to have results, we need them to do. It's a proactive medicine, longevity, right? So we need them to do the intervention that we actually told them to do. So just I want to show you some preliminary results. We already have 400 patients. As you can see here, the average age is 61. We have a little bit more women. 70% are married, 57 never smoke, BMI 26, for 61 is not bad. Regular physical activity, we can see it's 70%. I have to say it's high. Okay, if you ask general population who is doing 2 times a week physical activity, is around 30%. So you could see people that come to a longevity center from the beginning, they're a little bit more active. Insomnia, or borderline insomnia, is around 28%, which is it's kind of like in the what is known in the population. Hearing screening impaired, 40%. What was interesting is the MOCA score, which was a little bit low. MOCA is the cognitive test, which is 26 and above is normal. It was a little bit lower. And that was an interesting thing that we saw. And hematological age, you see that the patients were 3 years approximately younger in their biological age than their age. So good candidate, but it's only 400. I hope, I don't know what will be in the next 1,000. So as mentioned by Eva before, we're doing a lot of collaboration. We have with the Mayo Clinic and Singapore. We also published a paper which we are trying to have protocols and how to establish health and longevity in a public hospital. We have academic collaboration with Tel Aviv University, Weizmann Institute, Ariel University, and Reichman University. Industry collaboration with Quantalas. This is the machine that I told you, the Delphi. It's an EEG with a magnetic impulse. ASAP is actually an echo. This is a Shiba startup, which is doing a fast echo, 4 minutes, and then you get the ejection fraction, and the biological cardiac age. And Effective, it's an application for cognitive games, which we are also doing a collaboration and test with them. This is our website. You can see here, longevityshiba.coil. We have all what we are doing. We have 17, on top of SHARP study, we have other 17 research that are going on. And of course, we are happy to collaborate. I don't have it here, but we have our next conference. The second conference of Shiba Longevity will be in May 7 and 8. So you're, of course, all welcome. Thank you very much. Is there any questions from the audience? From the Zoom? Someone? Yeah. Wait, if we want...
very nice talk. How do you assess hematological age?
So we send it, it's a 45 markers, blood markers, and we send it to Deep Longevity. So we're sending outsource and they bring it back to us. So they have no idea who is the patient, what is the age. We send anonymously 45 blood markers and they give us back the blood age. 45, it's they are known. The 45 markers for hematological age usually are very steady. It's hemoglobin, hemoglobin A1C, blood, CBC, iron, alpha fetoprotein, a lot of... it is very common and the one that is already used everywhere.